How does adult ADHD affect dopamine pathways in the brain? Imagine your brain as a busy city with roads carrying signals between different neighborhoods. In adults with attention deficit hyperactivity disorder, or ADHD, some of these roads are less busy or not working quite right. This is especially true for pathways that use a chemical called dopamine. Dopamine is like a messenger that tells your brain when you've experienced something rewarding or important. It helps you feel motivated, stay focused, and control impulses. In adults with ADHD, studies show there are fewer dopamine receptors, especially D2 and D3 receptors, in key parts of the brain like the nucleus accumbens and the midbrain. These areas are part of the brain's reward system, which makes you feel good when you do something satisfying. When these receptors are fewer, the brain doesn't respond as strongly to dopamine. This means that rewarding activities may not feel as satisfying, which can make it harder to stay motivated or resist distractions. The dopamine pathways involved in ADHD also work differently in terms of activity levels. There are two types of dopamine activity, tonic and phasic. Tonic dopamine is the baseline level that keeps your brain alert and ready. Phasic dopamine is the burst of dopamine that happens when you encounter something new or rewarding. In adults with ADHD, tonic dopamine levels tend to be lower, meaning the brain's baseline is less active. Meanwhile, phasic dopamine responses can be more intense or unpredictable. This imbalance can cause inconsistent attention, quick shifts in focus, and difficulty learning from rewards or consequences. This disruption in dopamine signaling also affects decision-making and self-control. When dopamine pathways don't work properly, adults with ADHD might seek out high-stimulation activities or quick rewards to boost their dopamine levels. That's why some may prefer fast-paced or exciting tasks and find it hard to stick with long-term goals. The connection between dopamine and ADHD also explains why some adults with the condition are more prone to substance abuse. Because their dopamine system isn't functioning optimally, they might turn to drugs or alcohol to try to increase dopamine and feel better. Understanding how dopamine pathways are affected helps us see why medications like stimulants are effective. These drugs increase dopamine availability in the brain, helping improve focus and reduce impulsive behaviors. They essentially help to balance the dopamine levels, making it easier for adults with ADHD to stay attentive and control impulses. So, in simple terms, adult ADHD affects dopamine pathways by reducing the number of dopamine receptors and transporters in key brain areas. This causes less dopamine signaling, which leads to common symptoms like inattention, impulsivity, and a craving for immediate rewards. Recognizing this helps us understand why certain treatments work and how to better support adults managing ADHD every day.